Before we dive into today's discussion, I want to invite you to picture something for a moment. A world where healthcare doesn't begin in a clinic, but on a screen. A world where diagnosis starts with pixel, where medical guidance arrives through dashboards, and where doctor's office can fit in the palm of your hand. This is no longer the future, it's the reality that is unfolding around us every single day. The question is, how prepared are we to live, learn, and heal through screens? Hello everyone, my name is Mashukutsho and I'll be the host for today's panel discussion. Welcome to our session titled The Impact of Screening on the Healthcare Industry. Today, we will explore how technological forces known as screening, the rise of virtual interfaces, and digital display is reshaping healthcare from patient communication to diagnosis and beyond. I joined today by my three insightful panelists who each give will gonna bring unique perspective to this topic. First of all, Faraz Ahmed. Faraz examined how screen technologies are being integrated into real-world healthcare system. His focus includes telemedicine growth, patient communication through virtual tools, and accessibility improvement driven by screen-based platform. Anisai will gonna explain how both patients and healthcare workers interact with digital interfaces. Her background in user interface allowed her to investigate challenges like screen fatigue, information overload, and patient engagement through visual communication. Arun Kumar focuses on the futuristic side of screening, augmented reality, virtual reality, smart hospital display, and AI powered dashboards. His research highlights how immersive and intelligent screen system will redefine diagnostics and medical decision making in the coming years.
Screening is one of the major technological forces shaping modern society. It represents the rapid rise of visual interfaces and the way screens have become central to how people connect, work, and learn. Screens are no longer just tools, they dominate communication and decision making across nearly every field. Whether through smartphone, tablets, computer, or medical displays, screens have become more immersive, intuitive, and seamlessly integrated into our daily lives. Because of this shift, understanding the role of screens in healthcare is critical, as, as they now influence how patients access information, how clinicians diagnose conditions, and how data is communicated. So the expert will be told by Faraz Ahmed.
Thank you, Mashuk, for such a lovely introduction. And hello, everyone. I'm Faraz Ahmed, and I would like to initial my insights with the focus on the healthcare industry. We choose the healthcare industry because it is experiencing one of the most significant technological transformations today. In healthcare, screens are used in telehealth platforms, patient portals, mobile health apps, and diagnostic imaging equipment. This widespread use makes screening especially relevant. Screens help simplify complex medical information and make it more accessible for patients, whether a patient is reviewing test results online or attending a virtual appointment. Screens have become essential to ensuring continuity of care and improving the patient experience. This makes healthcare an ideal industry to analyze when studying the impact of screening. Now, moving on to the current findings summary. Our research revealed several key trends. First, telemedicine has grown rapidly. Virtual care adoption has increased dramatically as patients and healthcare providers embrace remote consultations. Second, AI powered imaging is driving major improvements in diagnostic accuracy. Intelligent visual tools help clinicians detect patterns that may not be immediately visible to the human eye. Third, wearable devices. They continue to rise in popularity, allowing people to track their health through dashboard style apps. Finally, we found a clear shift toward visual first communication. Patients increasingly rely on screen based information from charts to animations to understand their health better. Thank you so much. That was my input.
While screening brings important benefits, it also presents challenges. One major issue is screen fatigue. Both clinicians and patients often experience digital exhaustion due to prolonged screen exposure. In addition, information overload is a significant concern. Electronic health record dashboards, while helpful, can overwhelm users with large amount of data. There are also technical limitations, especially in low-resource communities where internet access and device availability may be limited. Interestingly, our research uncovers some surprising findings. For example, patients tend to trust visual explanations more than verbal instructions. This means that images, graphs, and videos often improve understanding and compliance. Another surprise is that older adults have adapted to telehealth faster than expected. Many seniors now feel comfortable participating in virtual care visits and using digital tools to manage their health. The technological force of screening offers significant positive effects for healthcare. One major advantage is increased access to care. Remote and virtual healthcare allow more patients to connect with providers without needing to travel. Another benefit is improved diagnostic accuracy. Visual tools and advanced imaging enhance precision in identifying medical conditions. Screening also enhances patient engagement, as individuals can better understand their health through charts, portals, and apps. However, there are negative effects as well. One risk is misinterpretation. Complex medical visuals can confuse patients if they are not clearly explained. Device dependence also presents challenges. If a patient lacks stable internet or technology, they may struggle to access care. Additionally, screen fatigue contributes to burnout among healthcare workers who must use screens extensively throughout the day.
Future predictions. Looking ahead, screening expected to transform healthcare even further. AR and VR displays will likely play a major role in diagnostics, medical training, and even surgical procedures. The immersive tools will allow cleanliness and to visual organize organs, system, and produces its way previously impossible. Hospitals may also adopt the equipped interactive screens that assist both patients and medical staff. AI-powered dashboards will come in evolve, providing personalized vision trends that adapt to each patient's unique health needs. Overall, screen will reshape medical decision making by providing clear, more interactive ways to patients provide community. And slide 8 conclusion. In conclusion, screening is powerfully rephrased the healthcare industry. It improves clarity, access, and diagnostic capabilities, making healthcare more efficient, patient-centered. However, it is also introduced challenges such as screen fatigue, data-driven overload, and technology inequality. As screen-based tools continue to evolve, the further healthcare will really highly an intelligent, impressive, and integrated visual system. These achievements will not only improve quality to care but also redefine how patients and clinicians interact with medical informs and references. Our research is based on reliable source from the WHO, CDC, US Health Human Service, and pre-reviewed uh, telemedicine studies, all supporting to impact screen of healthcare. Thank you.
So let's begin with the technological forces we selected. Screening. Screens has become main interface between patients, clinicians, and system reshaping communication, diagnosis, and decision making. They are more immersive, more emotive, and more increasingly interacted to daily life.
Exactly, Mashuk. What stood out to me is how screens dominate health communication now. Telehealth, imaging dashboards, mobile health apps all rely on visual clarity to support patient decisions.
Yes, for us. And with higher resolution displays and AI overlays, screens are not passive tool anymore. They actually guide diagnostics and treatment.
So why did we choose healthcare?
Because healthcare is undergoing a massive digital transformation, and screens aren't just add-ons, they're becoming central to care delivery. From patient portals to virtual visits, so much of healthcare now happens through a screen.
And it's also relevant, right? Because healthcare information is complex. Screens simplify it through visuals, graphs, and interactive dashboards. This bridges the understanding gap between professionals and patients.
True. But I argue that in some case, screen complicate things. For example, electronic health record dashboards can overwhelm clinicians with too much data.
That's fair, which is why interface design matters so much. Screening forces us to rethink how information is delivered, not just displayed, right?
Yeah, so maybe let's summarize what we have found so far.
So, first, we saw a massive surge in telemedicine. Virtual care has become normalized, especially post pandemic after COVID, right?
And we can't ignore the rise of AI-powered imaging. Intelligent systems help radiologists detect abnormalities with better accuracy.
Yes, a wearable device also play a huge role. Screens or smartwatches and health app give patients real-time and health dashboards.
And if you see closely, there's also an industry wide shift to virtual first communication, animations, charts, and even video explanations going all over the websites.
Yeah, that's true. So maybe let's talk about the challenges and surprises we have faced so far.
So a big one is screen fatigue. So both clinicians and patients experience exhaustion from prolonged digital interaction.
Plus interaction overload, too many dashboards, too many alerts. It can hinder decision making instead of helping it.
But I wouldn't totally agree with this because, on the flip side, one of the biggest surprises was visual trust patients actually trust visual explanations more than verbal ones.
Yeah, and another surprise, older adult adapting better than expected telehealth. Many assume that they're gonna struggle, but adoption rates have been impressive. So, like, what are your initial reflection and on the positive and negative effect, if I'm gonna ask you guys?
So I'd like to go first on this. Positively, screening expands access. People in remote areas can finally get consistent care.
For me, I think diagnostic accuracy improves with AI-enhanced imaging and high-resolution visuals.
Oh, critical perspective, but there are negative effects too. Many interpretation is a real risk when patients see complex medical images without context.
I agree with Arun on this. Along with that, device dependence, when the tech fails, the system collapses, right?
Also, the screen fatigue contributes to burnout.
Yeah, that's true. So let's look ahead with the prediction we can make for this like topic.
Yeah, I see. AR VR display become mainstream in surgical planning, diagnostics, and medical training.
And my insights on this going to be smart hospital rooms with interactive displays will create a more intuitive patient experiences.
For me, I think AI-powered dashboards will provide personalized visual interfaces based on each patient's data and behavior.
Yeah, and overall, I think screens will reshape the decision making, making healthcare more visually guided and patient central or patient oriented. So
Mhm.
basically, to wrap up, screening is transforming healthcare from every angle. It enhances access, improves clarity, and enables better diagnosis, but also introduce challenges that like fatigue, overload, and tech dependency. The future looks immersive, intelligent, and highly visual. So thank you to my panels, Faraz, Annie, Arun, and thank you to our audience for joining us today. Thank you so much.
Yeah,
Thank
thank you.
you. Bye-bye.